Okay, birth breathing. We're going to review the actual technique when we cover birthing. But birth breathing is used when you're breathing your baby down during the birthing phase of labor. It's intended to assist the natural expulsive reflex, or NER, of your body to move your baby gently down to crowning and birth. Many moms report using only 1 or 2 birth breaths to bring their babies to full emergence. That's because the sphincters at the outlet are not tense and closed. The relaxed body will be naturally open for you. Birth breathing also gives your baby the advantage of a kinder and safer birth. As your baby's head becomes visible, you'll use this downward breath to help birth the baby past the opening folds of the perineum. While in labor, just follow your body's lead and work with it when you feel the onset of a surge or contraction. Okay, so these are the relaxation techniques we're going to talk about. The first 2, progressive relaxation and disappearing letters, are quick ways to bring your body and mind into relaxation. Light touch massage, you'll need a support person to practice with.
Progressive relaxation. While sitting in a comfortable chair or on the couch, associate each of the designated parts of your body from the top of your head to your toes with the number that corresponds to the graphic. Take a deep breath. Then as you exhale, let it all immediately flow throughout your body, causing your muscles to totally go limp.
Okay, so eventually you'll be able to take 1 breath and rapidly count off the numbers as you exhale, bringing the corresponding parts of your body into a limp state immediately. You'll want to let your body go absolutely limp from the top of your head to your toes, and let your head hang loose. Let your arms and hands fall limp. Disappearing letters is a similar exercise. It's the easiest of all the instant relaxation techniques that you'll use. And as an added bonus, it's a great technique to use if you feel stressed during the day or if you need some help falling asleep.
Disappearing letters. Close your eyes. Take in a quick, deep breath. Now pause. Quickly visualize the letters rolling by or coming forward and mentally recite to yourself quickly while you exhale. A, B, B, C, D, D, and so on. Allow your head, neck, shoulders to instantly sink into the frame of your body. Let your arms, hands, and legs hang loosely.
All right, light touch massage. This is probably my favorite relaxation technique, and it's a super sneaky way to ask for a back tickle from my husband, because I can say, well, honey, I'm just preparing for childbirth. I actually found that during child labor, I didn't want to be touched, but it's a good way to teach your body to relax. So you never know exactly what you're going to want during labor, and that's why we teach so many different techniques, so you can pull out your favorites and what you feel that you need when you are actually in that situation. So the theory of light touch is that the smooth muscle just below the surface of the skin, which is called erector pili, reacts by contracting when stimulated. And when this happens, the muscle pulls up the surface hair, which becomes erect and causes goosebumps. The goosebumps, in turn, help to create endorphins, which are the feel-good hormones that further promote relaxation. The great thing about endorphins is that when they're secreted, catecholamine, which is known as the stress hormone, is not. So you can see how this is a super effective way for moms to remain calm and comfortable both prior to birth and during. I realize that not everybody is comfortable or enjoys touch as a relaxation method, so as with all of these methods, just put into practice whatever works best for you. There is a specific technique for light touch massage, but keep in mind that whatever form of touch is soothing to you is going to work. So feel free to incorporate hand or foot massage, scalp massage, or whatever type of touch brings about relaxation for you. But we will go over the actual technique on the next slide.
Light touch massage. You'll need your birth companion to be with you to practice this technique. Your support person places the backside of their fingertips so that they meet lightly at the base of the tailbone. The fingers are then drawn up and outwards from the spine in a V-like pattern. The pattern is slowly continued upward across the back until the neck is reached. The hands are then brought around the neck and to the sides of the ears. The second motion involves placing the back of the fingertips at the base of the spine and then, like before, slowly working upward, forming a horizontal figure 8 pattern that crisscrosses at the center of the back.
And now we're moving on to visualization techniques. So these are techniques that will also require you to have some time to focus and be comfortable. You'll want to be free of distractions. Rainbow relaxation, the depthometer, and the sensory gate valve are great visualization techniques to listen to along with your support person. You'll both enjoy the relaxed state you feel together. The opening blossom and blue satin ribbons have to do with your cervix and uterine muscles, so your support person probably doesn't care to do those visualization techniques with you. As I mentioned earlier, these take some time, so if you have time to do them now, go ahead and play them. The links are at the bottom, or you can download them and listen to them when you have time. Like I said, I used to listen to, my favorite is the Rainbow Relaxation, and it's what I'm listening to now. Rainbow Relaxation and Birth Affirmations, which comes later in the course. I usually switch off between those two at night while I'm in the bath. Pick which ones you like, though. I realize that my favorites aren't going to be everybody else's favorites, and that's why I included a couple different techniques on there. And feel free to do them when you can. I do want you to try every single one of them so you can figure out what works best for you. So maybe during this next week you listen to one every night of the week and decide, which ones you respond best to, but give them all a fair chance. So we'll just click through here. Rainbow Relaxation brings you through just that, the rainbow and the colors, and the colors each have corresponding meaning. The Hypnobirthing CD, their Rainbow Relaxation goes into more of what each of the colors mean. My Rainbow Relaxation tape that is recorded is a little bit shorter, and we don't necessarily go into what all the colors might mean. The opening blossom has to do with your cervix. Blue satin ribbons has to do with your uterine muscles. And then the depthometer and the sensory gate valve are both ultra deep relaxation techniques. So you're kind of taken into a different world in these techniques. And if you have a really visual mind, I think these ones are really great. My husband really liked these ones. They worked well for him. So like I said, just try each of them and decide which ones work best for you. Okay, I realize, perennial massage, that this topic can be super awkward to talk about, but I'm just going to get real candid about it because the benefit to doing perennial massage is not tearing during delivery, which is obviously ideal for your postpartum recovery. So perennial massage is one of the best techniques to improve the health, blood flow, elasticity, and relaxation of the pelvic floor muscles. You'll practice this during the 3rd trimester. You'll do it about 6 to 8 weeks before you hit full term. It helps to increase your chances of birthing your baby with an intact perineum, like I mentioned, no tearing. So we have a PDF on how to do this technique included in the links below. I'm sure you all wanted to listen to me talk about how to do perennial massage, but no, I'm kidding. It's better if you just read it and practice it on your own or with your support person, but don't take it for granted. I did with my first baby, and I ended up having to have an episiotomy, and I wish I had paid more attention and been more serious about utilizing perineal massage. So, affirmations for easier, comfortable birthing. This tape is so important to prepare your mind for comfortable labor. Whether you've decided on an unmedicated or medicated delivery, this tape is awesome because it frames birth in such a positive way. I personally listened to these affirmations on a loop from the time my water broke to the time I gave birth. It got me through my unmedicated delivery. So in conjunction with using the breathing techniques, it just helped me to remain calm and totally relax in between contractions. I do feel like in between those contractions, I was fully able to relax my body. And like I said, I used to switch off every night listening to these birth affirmations or the rainbow relaxation tape while I took a bath with Tally, and I am continuing that pattern as I prepare for the birth of this baby. So repetition is obviously, that's one of the laws of the mind that we talked about. Repetition is important for this. And then just getting in the right mindset is going to help you have success. All right, now we're getting to the fun part, to the actual labor part. With Braxton Hicks or practice labor contractions, they'll be erratic and they won't form a pattern. That's how you'll know that they are practice labor. The length of the contraction will differ from one to the next, and there will be an absence of other signals that labor has actually started. If you're experiencing Braxton Hicks or practice labor contractions, lay down, change your position, lay on your left side, and oftentimes the contractions will totally disappear. On the other hand, they might continue at 5-minute intervals for a day or so before real labor actually begins. So they can be little tricksters. The next labor preparation or labor sign that your body's preparing for labor is lightening. So baby settles or drops lower into mama's pelvis, and this usually happens about 2 to 4 weeks before delivery. The next preparation for labor sign is vaginal discharge and mucus plug. So throughout pregnancy, a mucus plug blocks the opening of the cervix to prevent bacteria from entering the uterus. Before labor, this mucus plug is expelled, allowing the baby to pass through the cervix during labor and birth. So passing a mucus plug is a sign that your cervix is dilating and that your body is preparing for birth. Labor, unfortunately, could be hours, days, or even weeks away as the cervix gradually opens. So it doesn't necessarily tell you that you're going into labor, but it's a sign that your body's preparing. The mucus plug is usually clear, slightly pink or blood tinged in color. It can be stringy mucus or a sticky discharge, and some might not even notice the loss of their mucus plug since there's already an increase in vaginal discharge during pregnancy, especially during the 3rd trimester. You'll definitely want to call your healthcare provider if your discharge turns to bright red.